Hello, my name is Leonel Sabaya. Today I'm going to perform motion of range. This exercise that are performed by patient himself or by the nurse in case of helpless patient to mobilize all joint through their full range. ROM exercises are those which a joint is moved through its full range of motion according to its capacity. The purposes of range of motion are to increase muscle strength and endurance, to maintain normal physiological function, to prevent complications caused by immobility like contractures, to improve patient participation in activities of daily living, to improve physical activities, and to increase joint flexibility.
There are two types of range of motion: active, done by patient himself; passive, done with help of assistant from another person. Start providing range of motion exercises from head to downward. From the neck, move head through flexion, extension, lateral, rotation, hypertension. Movement of the head is contraindicated in spine surgery, spine trauma, and patient having central vine line. Inferior rotation, movement of the capsula during upper limb adduction, in which of glenoid cavity of the scapula moves in a downward direction as the medial end of the scapular spine moves in the upward direction. Lateral exertion, side to side movement of the midline away from the midline towards either the right or the left side. Lateral flexion, bending of the neck or body toward the right or the left side. Trunk flexion, extension, hyperextension. Lateral flexion, rotation. As a client in a range of motion in bed, first you need to perform hand hygiene to prevent spread of infection.
Hi Sheila, my name is Leo. I'm your caregiver today. Today I'm going to help you with your range of motion exercises. Is that okay?
Okay.
Okay, let's begin.
We were going to start with shoulder exercises. With flexion, extension, flexion, extension, the upper arm. Control the client on the other side so you can do hypertension of the shoulder. We're going to do abduction and adduction. Abduction, adduction. Next is rotation of the shoulder. Outer rotation, inward rotation, outward rotation, inward rotation. Make sure that the upper arm is at 90 degrees from the body. Elbow, flexion, extension, flexion, extension. We also do supination and pronation. Supination, pronation. We're going to work now with the wrist. Start with flexion, extension, hyperextension, flexion, extension, hyperextension. We will turn the hand and we will do radial deviation and ulnar deviation. Radial deviation, ulnar deviation. On top, abduction, adduction, abduction, adduction. Flexion, extension, flexion, extension. Do opposite to the little finger. For the fingers, abduction, adduction, abduction, adduction. Work each finger individually. For the fingers, do flexion, extension, flexion, extension. Where we're going now to do the leg exercises. Expose one leg only. We're going to start from the hip, where we're going to flexion, extension, flexion, extension. Adduction, abduction. Outward rotation, inward rotation. For the knee, we will need to start with flexion, extension, flexion, extension. We will move now to the knee. Dorsal flexion, plantar flexion. Dorsal flexion, plantar flexion. Inward rotation, outward rotation. We're going to work now on the toes. Adduction, abduction. Adduction, abduction. Working each toes individually. And we will do flexion, extension, flexion, extension of the toes. And we will go to position the client for the comfort. Perform hand hygiene to prevent the spread of infection.